Hello class, good afternoon. So today, let's deal with health and our topic is getting to know the first aid principle. So, what are the things or what are the characteristic of a good first aider? First is the first aider should be well trained and has taken courses in first aid. She must meet the give care with confidence to the victim. So why do we need that you should be well trained? Because you should know what you are doing. The life of the patient or the victims depends on you. And not only that, but you must be confidence in giving care to the victim. Number two is he or she must do his best without any form of negligence. So you should be willing to do your best to help the victim. And number three, he must build trust to the victim who needs assistance and treatment. So how can you build and trust to that victim in a very short period of time? So before you do the first aid, then you should talk to the victim if he is still or he can still speak. In that way you can build trust to the victim and he will allow you to do the first aid. So next is the responsibilities of a first aider. That's why in the first part of this discussion we talk about the good characteristic of good first aider because you have the responsibilities as first aider. Next is assesses the situation objectively and quickly what happened to the area. Next is protects and helps the victim from possible injuries or danger, and that's your main responsibility to protect the victim from possible injuries or danger. Next is give immediate treatment to or facilitates the transport of victims to the nearest hospital or medical facility. So facilitate meaning to say you will assist the victim, okay, to transport to the nearest hospital or medical facility. So you should know how to do the proper carrying of the victim and the first aid and the actual first aid. Next is gives immediate treatment first to those who have serious conditions. So as you go to the area and after assessing, then you should give the first treatment or you should give immediate treatment to the victim. Next is stays with the victim or injured person until appropriate treatment is available. So you will okay, stay and assist the victim until there is doctor or appropriate treatment for that one. Next is give accurate report. So when the doctor asks you about what happened to the victim, then you should give the accurate report because as you go there to the area, you assess the situation objectively and quickly. That's why when you give report, it must be accurate. Next, what are the basic first aid principle? The first one is initial observation. As it is stated in the responsibilities of first aid or first aider, observe the environment and situation for possible harm and dangers. So um this one is applicable when you go to areas affected by earthquake, because there must be a possible of aftershock. Keep oneself from risk in trying to help or rescue a victim. So as you help or rescue a victim, you should think for your safety. Always display self-confidence and knowledge. So as you perform first aid, don't be nervous, just be calm, quickly, and efficient. Next is check whether the victim is conscious by tapping him on his shoulder. So why is it important to check if he or she is conscious, so that you can do the chest pump or mouth to mouth. So you can just ask him, are you okay? If there's no response, shout for help to call attention of other people nearby. And the last one is ask someone to call for medical help. Number two is implement the immediate action. The first aider should have a quick plan of action. So as you done with the initial observation, then you should think of the immediate action. So effective and immediate first aid gives a better chance of a good and fast recovery for the victim. So it also helps keep the relatives of the victims remain calm and avoid panicking. So how do first aiders protect themselves from infection? First is always wear protective gloves. Number two, get immunization against hepatitis V, or have a vaccine of hepatitis B. Number three, protect all skin wounds with a waterproof bandage. So always sanitize your wounds. Always wear protective apron when dealing with injured victims. Wash the skin thoroughly when it gets in contact with the injured person's blood. And number six, be sure not to prick yourself from any sharp object found near the injured person. That's why you should observe the environment and situation for possible harm and danger for you and for the victim. What are the things that you should do when you need medical assistance? First, call the emergency hotline. So they tell you the services such as ambulance, experts, rescuers, fire, and police that they can provide as early as possible. So give the exact information about the emergency. The following information listed below should be conveyed to the operator. First is introduce yourself, the caller's name, your exact address or location of the accident, landmark of the location, type of accident, number and condition of the victim, how many victims or what happened to the victims. But I just want to tell to you that do not prank these call emergency hotlines. For your activity, answer sentence completion on 341. Take a photo of your answers and send it via private message. Deadline March 19.